Okay, so now we are going to look at blood supply to the brain and cerebral cortex via circle of Willis. Cerebral cortex has blood supply from circle of Willis. Arteries are anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. Anterior cerebral artery blockage results into the stroke, and mainly lower limbs are involved because it supplies the frontal and parietal lobe. Clinical scenario are contralateral leg weakness and sensory loss. So just I want to share a trick with you. Whenever you study anything in the medicine, always try to understand that what will happen if this thing is distorted. So middle cerebral artery involvement results into the stroke, and then face and upper limb weakness, and posterior cerebral artery results into the visual cortex involvement. So in this way, the different arteries blockage leads to different problems, like anterior cerebral artery results into the leg weakness, middle cerebral artery results in the face, and posterior cerebral artery results in a visual and occipital region involvement. Here you can see circle of Willis having all these anterior, middle, and posterior cerebral artery that are forming a circle of Willis, and through the anterior cerebral artery are two here connected via these arteries, and then to the middle, and then to the posterior, and then in this way whole arterial villus is formed. Now as you can see clear in this picture, it is shown that anterior communicating artery communicates to anterior cerebral artery, and then anterior cerebral arteries are joined to the internal carotid artery, and then middle cerebral arteries, and then posterior communicating artery, and then posterior cerebral arteries, and then there are basilar arteries. So this way circle of Willis is formed, and blockage of any of these arteries results into these type of problems. So in this way we can diagnose and perform CT scan, and we will look at the blockage or any arterial occlusion. Okay, so two vertebral arteries joined from basilar artery, and then posterior cerebral arteries joined to the middle and anterior cerebral artery and form circle of Willis. So in this way, middle cerebral artery, anterior cerebral artery, and anterior communicating arteries perform circle of Willis. Shape is pentagon-like. It is located into the subarachnoid space and near optic chiasma. So any bleeding from art circle of Willis, blood will be subarachnoid accumulated into subarachnoid space. Anterior cerebral artery, middle and posterior cerebral artery are forming the circle of Willis, and any pathology in any of them results into anterior cerebral artery results in lower limb involvement, middle cerebral artery results into face, and posterior cerebral artery results into visual problem, like occipital region is mainly contributing to the vision. So that's why visual problems will be there.